to a Better Health Together conversation, and I'd like to introduce Antonella Segre, CEO of ConnectGroups. Welcome.
Thank you.
Now, this is quite an interesting conversation, a little bit post-COVID, but not quite, and related to telehealth. And we worked with you, I think you took the lead, to be fair, on working with people and consumers to be able to use telehealth well. Can you tell me a bit more about what it was you actually did?
Oh, absolutely. So let me just take a step back. So we're the peak body for support groups. 35% of our members are support groups with chronic conditions.
Okay.
So early in the piece, when, let's say, we were at the height of COVID, as we were canvassing our members, it came to our attention that they were not going to their GP appointments, they weren't going to their pathology appointments, and that raised a real red flag for us. So we knew that telehealth was out there, so we became quite inquisitive as to why were they not utilizing it. Also, because we ran a program out of Fiona Stanley Hospital called the Community Link Booth, we were getting data from Fiona Stanley Hospital saying that there was this absolute decrease, as one would have expected at the height of COVID, in people presenting, and that they used to have quite few people with diagnosed chronic conditions presenting at ED. So that's where we looked at our engagement with yourselves, with WAFA, to see how can we work collaboratively to increase the confidence. That was the main key. How do we increase the confidence for the utilization of telehealth for our members and try to sort of, really promote it and get it out there. So that's where it sort of came from.
Yes, and it's interesting, isn't it? Because my sense is there were challenges for GPs or clinicians and for consumers of health services. Could be different challenges.
Absolutely.
And I guess what you were both helping people with, but also learning, is what are those things people need to think about if they're going to have a telehealth consultation?
Absolutely. So, obviously we knew that a lot of them thought, oh my God, we're going to have digital literacy. And they were thinking, oh, I don't have any knowledge. I'm not aware of it. So we had already started to conduct some work for our members themselves about how to use Zoom, and we were providing resources for them and so forth. But a lot of them were, well, if I call my GP practice, are they really going to ask me if I can use telehealth? So as I said, it was all about that confidence. What do they need to know? And what we also came to the conclusion was that the best people to get the message out was not going to be us. It wasn't going to be yourselves, because they weren't engaging with it. So it was going to be the champions of those support groups. So that's where the success was.
Okay.
So we engaged, we looked at those diagnosed chronic conditions, found those champions, and said, if we get the conversation and we get the communication and the promotion through you, we're actually going to make some form of an impact around that confidence level of the utilization rate.
So for people, it was nearly like someone they knew was talking to them about how to do it, what to think about.
Yes.
And so forth. Telehealth per se is not going to go away.
Which is great.
If thinking about that and going forward,
yeah,
what are the key lessons or key points that we need to hear to help influence and shape what happens next as telehealth progresses?
Yeah, I think one of our biggest learning is that we received was our members really pushed the fact that telehealth used to be only for regional.
Okay.
So always was for regional clients, that clearly, because there's obviously not the same level of service that we have in the metro area. But the key message from those with chronic conditions was we should have telehealth as a full ongoing version. So someone that has pulmonary hypertension, that has to travel with an oxygen tank, they're actually putting their life more at risk by trying to get to their GP appointment or to their specialist appointment or to pathology. Of course, we can't override that. And so those are the lessons learned, that telehealth shouldn't just be catering from a regional perspective and should actually be seen as it's a huge benefit to the system if consumers can continue to utilize it with those kind of conditions. So that's a real learning.
Well, thank you so much, Antonella, for sharing that, because I do think for people who will listen to this Better Health Together, we'll learn some new things here, and we can never, ever underestimate the importance of engaging people who are using the healthcare system to help shape and drive and make it really work for them.
Absolutely. And thank you for having me today.
And thank you. And thank you very much. And bye for now.